The 5x5 protocol entails giving radiation over a 5-day period in combination with full-dose chemotherapy shortly after the radiation is ended. This allows the patient to get much more effective chemotherapy before surgery and is quite a bit different to the traditional way of giving radiation, which is a 5-week radiation. We typically give 2 months of chemotherapy, and then a month after that, we restage the patient. What we have found in our experience over the last 2 years is the tumors have responded a lot better. Some have actually completely disappeared, and up to probably 30%. And we're in the process of reviewing our results and both present them and publish them nationally. So there are multiple advantages. First of all, the radiation itself is abbreviated over 5 days, so it's not as hard on the patient to actually fit it into their schedule. After that, they take a break of 2 weeks, and then they get chemotherapy, and it's sort of full dose chemotherapy. That can be hard on the patients, but what we have actually found and experienced that most patients tolerate it well. So that goes on for 2 more months. The benefit is in patients, for example, if they had a little bit more of an advanced tumor, we're actually able to deliver real-time or real-dose chemotherapy as opposed to the chemotherapy that's delivered with a traditional 5 weeks. The 5 weeks has usually been given with one drug, which is a radiosensitizer. It's called 5-FU or capecitabine. The advantage is you can't really usually combine full-dose chemotherapy with the radiation. It's felt to be too toxic to the patient. So that's one advantage of the 5x5. As I mentioned earlier, also we feel that we've had better responses by giving chemotherapy up front as well as radiation than the traditional 5 weeks. So that's another advantage. And lastly, there is this concept of sort of giving as much chemotherapy before surgery or upfront, because if patients go to surgery and there are complications, then they might not be able to get chemotherapy after. So then you're delivering effective therapy before surgery. We've had many success stories with the 5x5, and I'll share with you a few. There have been patients who've been given this therapy or this regimen who have completely responded to our treatment, and we have decided to watch them and not do surgery on them. Now, this is not a well-proven way of treating this disease. However, the tumor completely disappears and there is just a scar. The other advantages or other patients have had complete shrinkage of their tumor and allowed a very difficult surgery to be done a little bit easier. And lastly, patients with stage 4 disease, if they have metastasis to other organs, it again allows us to give systemic therapy ahead of time and address both liver and or rectum at the same time when it does come time to surgery. We've had up to 30 or 40 patients that we've treated in this protocol, and really we've not had any of these patients have an adverse event or any bad outcomes from this therapy. I can't really make a comment whether we have better cure or not, but I do believe that delivering the chemotherapy up front gives us the advantage of curing if there's small metastasis outside, but there is no really substantiated research or anything to back up this claim. There has really been no studies to look at functional outcomes after surgery from this method versus the traditional method. So to say that this is completely better, I think it's not necessarily true, but it's very much convenient, if you like, for the patient to receive this therapy the way it's structured and the way that we deliver it, because it doesn't take away too much time. So if somebody's working, they take a week off from the radiation, and then they go back to work. And then the chemo is delivered once every 2 weeks for a period of 2 months. And usually for a day or two, you're tired, and then you get back to work. So there are far less interruptions to the patient's quality of life, with a very strong potential improvement in outcome post-op, or eventually sort of long-term.